everyone, my name is Lali. I will be representing the amazing Repro Renegades group, and our project is reimagining possibilities for unhoused youth and their sexual and reproductive health in San Francisco. So to start off with, every year 4.2 million young people in the US experience homelessness. But here in San Francisco, this isn't just a statistic. It's a crisis felt by nearly 1,200 of our youth right now. Unhoused youth face elevated rates of STIs, HIV, unintended pregnancies, and sexual violence due to survival, sex, and other structural inequities. A lot of barriers to access also exist for these groups. Traditional sexual and reproductive health services are hindered by both institutional barriers, such as restrictive consent laws and fragmented healthcare systems, as well as social barriers, such as stigma and medical mistrust. Our group felt really drawn to helping this population. I know I'm from the Bay Area, so I have really strong ties to this group, and a lot of our other members have kids or family members who fall into this age range, and so our passion kind of serendipitously lined up with the work of one of our colleagues, April Bell, who already has a connection to the Lower Polk Tay Navigation Center. And this is an amazing organization here in San Francisco that's actually requested our partnership to fill these critical gaps in outreach and education. So we really want to look for some community-based strategies that we can implement to help them out. So the first step in this process, we really wanted to design a research team that was grounded in reproductive justice and individual bodily autonomy. We want to go past just being a group of researchers, but rather forming a collaborative unit that included youth experiencing homelessness that we can talk to through the shelter, social service providers at these transitional youth centers, as well as experts both on our team, such as those who specialize in human-centered design that we work with, as well as those who specialize in reproductive justice at the Girl X Lab that April Bell works at. The next process we really want to delve into is our human-centered design phase, and we hope to utilize the double diamond design process here. The first step of that is the discover phase, where we hope to focus on a literature review of sexual and reproductive health needs and experiences of unhoused youths, and then pairing this with data from 10 stakeholder and youth interviews recruited via the Tay Center. We also hope to conduct 3 focus groups, one on cisgender women, one on cisgender men, and one on transgender youth. We just want to make sure we capture both the experiences of different genders and the LGBTQIA population, which is particularly at risk with a lot of these issues. And then just putting these into more contextual observations from speaking with those at the 3rd Street Youth Center and Clinic, just to really help drive the next part, which is our defining process. This is really the crux of our project. We hope to have youth-led co-creation workshops that can help us provide iterative feedback on 3 discovery outputs. Our first output is affinity mapping, which is where we hope to cluster findings and surface themes and divergences. The second is a journey map, which is a snapshot of a youth's daily life, goals, challenges, and intervention points. And here we have an example that some of our expert team members have developed from previous community-based initiatives that have been similar to ours. And then our final output would be an insight statement, which concisely articulates sexual and reproductive health needs and preferences. So yeah, really our goal here is to co-develop a set of opportunity statements to guide future idea generation. So making sure that all our future ideas are rooted in the community that needs them most. Yeah, and overall we really urge you to support this community engaged project that is focused on unhoused youth in SF that will allow us to respond directly to the needs that the Tay Center has told us they need. Our approach is super innovative as it lies in going beyond the standard human-centered design process to integrate both social science theory, so making sure that our interventions have clear theories of change and allow for broader adaptability. Okay, thank you. And then also implementation science principles from the beginning, so making sure considerations of feasibility are consistent from the start. And our team has really great experience in this. We have a lot of passion, and we hope that in the long term we can continue to build our partnerships and lead to bigger interventions in the future. Thank you. Woo!